Good afternoon. My name is Bridget Walsh, and I'm Senior Policy Analyst at the Schuyler Center. And it is my pleasure to host this afternoon's conversation on children's oral health. This is one of a series of conversations that we're holding during our 150th anniversary year. The Schuyler Center for Analysis and Advocacy is a leading statewide policy analysis and advocacy organization working to shape policies to improve health, welfare, and human services for all New Yorkers, especially those who are impacted by poverty and racial inequity. For 150 years, the Schuyler Center's work has been focused on advocating for public health and policies that fight child poverty. Today, our advocacy and analysis priorities include child health, child poverty reduction, universal child care, and child welfare. It is my pleasure today to introduce two colleagues and friends that I've had the pleasure of working with to improve children's oral health. And I want to thank you all for being there. So Tony and Deanna, if you want to come on in. All right, great. First, I want to introduce Dr. Anthony Mendocino, who is the dental director at Finger Lakes Community Health. He is known by many as Dr. Tony for his work in children's oral health. Dr. Mendocino received his undergraduate degree from the University of Rochester and his dental degree from the State University of Buffalo School of Dental Medicine. He completed general practice residency at the Veterans Medical Center in Buffalo, New York. He has 30 years of clinical experience in community dental health. Dr. Mendocino serves as the Chief Dental Officer and provider for Finger Lakes Community Health, overseeing dental services at 8 fixed sites, as well as an extensive mobile portable dental program across Western New York. And I think we're going to hear a little bit about that today. Dr. Mendocino was instrumental in setting up the teledentistry program in collaboration with the Eastman Institute for Oral Health in 2010. Our other panelist is Dr. Deanna Richardson, who currently serves as the State Dental Director to the New York State Department of Health in the Division of Family Health. Dr. Richardson has more than 20 years experience in training in oral health promotion, prevention, and coordinating, managing, and directing dental public health programs. Her interests in oral health related quality of life and the cost effectiveness of oral health programs has guided her career path in state oral health programs to focus on working to address health disparities in vulnerable populations. And Dr. Richardson completed her undergraduate work at Xavier University of Louisiana and received her DDS from Harry Medical College School of Dentistry in Tennessee. She received her Master in Public Health degree at the University of Rochester Medical Center, where she also completed postdoctoral training in general dentistry, health services research, neurodevelopmental disabilities, and public health. So the plan today is for a 20 to 25 minute conversation on some of the topics in children's oral health, and then we'll take some questions if we have time at the end. You can put your questions in the Q&A at any time during the presentation. And finally, our recording will be up on our website tomorrow so that you can share it with your colleagues. So with that out of the way, I'm going to open the conversation with a question for Dr. Tony. So why should children's advocates, health providers, and policymakers care about children's oral health?
Well, Bridget, I think that we're all finally realizing that children's oral health is part of a child's overall health. And statistics show that children from the ages of 5 to 17 miss nearly 2 million school days, which equates to about 34 million school hours per year. It's been shown that children with poor oral health are more likely to perform poorly in school. Untreated caries can cause pain, infections that may lead to actually death, as we know from a case in the past that occurred. And problems with eating, speaking, playing, learning, focusing in school. If not eating properly, it affects nutrition. And I am definitely an advocate for early intervention. And I think that dental caries is probably one of the most easily preventable diseases. And it can be done with minimal intervention and education.
Well, that's great. I mean, I think that really shows sort of why we need to be focusing on children early, right? Prevention of dental disease as early as possible. So, Dr. Richardson, sort of same question from the point of view of the health department. So, why are we interested in children's oral health? And then, if you could follow that up a little bit with talking about some of the projects that DOH is involved with right now to improve children's oral health.
Well, as Dr. Mendocino, thank you, Bridget. As Dr. Mendocino mentioned, oral health, the mouth is a part of the body, and oral health is a part of overall health. And the Department of Health has, I think, well recognized that for many, many years in terms of the programs and initiatives that are supported by the Department of Health. We have been a long time supporter of community water fluoridation, which remains the most effective intervention for reducing the prevalence of tooth decay. In the 20th century, it was deemed one of public health's most revered public health practice. Therefore, the Department of Health supports community water fluoridation efforts with state funding to pay for planning, repairing, maintaining, and monitoring public water systems that are fluoridating their water. And that's water that is public water systems that support 5,000 households or more. And at this point, we in New York State, we have 71% of the New York State population who benefits from public water systems that are also receiving fluoridated water. I think another main support that the Department of Health has been devoted to is school-based health centers, of which oral health programs are a large part of that. So the department, through the Division of Family Health, supports school-based oral health program dental centers. And these programs are designed to provide access to care to children that might not have access to care in their local communities for whatever reason, either because they have trouble accessing care because of their geographical location, or because they have issues with just utilizing the services that are within their community. And for that reason, school-based health centers provide preventive and restorative care in many cases through 3 modes of operation. So some schools have fixed dental clinics where the clinic is housed right inside of in the schools. But many of our programs either drive up a mobile dental clinic right up to the school site, either a RV or some type of mobile van. And other clinics actually are portable, where the providers bring in portable dental equipment and set it up inside of a school and a designated space that they're given. And currently, school-based health centers are, we have about 2,000 schools statewide that have dental programs offered in them. And they're providing, as I mentioned, preventive care, which includes sealants, fluoride varnish, and they are also receiving other limited routine dental services as well. And these dental clinics are supported by Article 28 facilities.
Yeah, you talked a little bit about, so just to clarify a little bit, so the fluoride varnish and the sealants are both applications on the teeth to,
Right.
to sort of help prevent disease, because a lot of times people don't know. We're talking about fluoride varnish and sealants, and so these are prevention
That's right.
initiatives that can actually keep kids from getting dental disease if we can get these on their teeth early enough and consistently enough. So it sort of brings me back to Dr. Tony. So your program there at Finger Lakes Community Health is really well known in the public health circles for the work that you're doing out in communities, taking care to kids, caring for underserved populations throughout the central region of New York. talk a little bit about the populations you serve and some of the initiatives that you have underway to care for children. Oh,
So all but one of our fixed sites are
Tony,
located.
can you speak up just a
Sure.
little bit?
So all of our sites except one are in rural communities. And as Dr. Richardson had mentioned, sometimes access is an issue. So our school-based programs reach out to those children. We have programs at the Head Starts to reach out to the children as well. And we provide, interpretation, transportation. We have a teledental program with Eastman Dental Center where we refer our kids over to Eastman to have services done in the OR or done with sedation. But some of the projects that we're working on is, it's been noted that fluoride varnish does help to decrease the amount of caries that a child receives. So it's advocated that 4 applications a year should be done. So what we're doing is we're trying to, with the New York State Dental Association, get approval from the state to allow parents and guardians to apply fluoride varnish at home on their children's teeth through telehealth, and actually a live teledental visit with a hygienist, sending a unidose of fluoride home with the family, setting up an appointment, and then setting up a teledental visit for the parent to apply the varnish, since it is a procedure that takes about 2 minutes. Unfortunately, sometimes parents miss those appointments because they feel that to drive in for a 2-minute appointment is not available, and it's probably the most important appointment that can be done. We're also utilizing a community dental health coordinator, which is a dental hygienist who has gone on for some extra training that gets out into the community and does education, presents at school fairs. And we're also utilizing telehealth in that regard, where high-risk families are able to set up an appointment through telehealth, and our CDHC reaches out to them through a teledental visit in the evening or on Saturdays to work with the families with a live visit regarding nutrition, oral hygiene, finding dental homes for that child and anybody in that family. So those are a couple of things we're doing utilizing telehealth. We're also working with pregnant moms. Any pregnant moms that come into our practice on the medical side are given a dental appointment, and we are educating them and again, working with them to make sure that, number one, their oral health is in good shape prior to that delivery. And number two, once that child is 1 year old or has their first tooth, that they come into the dental office or in a dental home and get that first application of fluoride varnish applied.
I'm going to just ask both of you a quick question here. It's a little off what we had planned, but I have heard both of you speak very eloquently in the past about the impact that the services that you provide have on children and families. I mean, we know why it's important, because we're talking about, missed school days and the impact on other types of health of a child, to have, poor oral health or have active dental disease. Can you just sort of mention like what your passion is for this? Like when you treat children, when you work with children, what do you see when you've been able to provide these services for kids and their families?
I could start on that one. I mean, the thing that has affected me in my 30 years, I love kids. I think that I'm a child at heart, even though I'm in my senior years, and it just kills me. It eats at me that I know that dental caries is so easily preventable with a minimal amount of money, just some education, and just trying to change that paradigm. For 30 years, that's what I've been trying to change and go from this attitude of drill and fill to educate and prevent. And I think we're finally getting the community and the medical providers and everyone out there to finally realize that it's simple and it's not difficult, and why make it difficult? So that's my mantra, is it's just that it's easy and it's accessible and there's insurance out there. And why do people not show for appointments when they're covered with they have insurance? Because they're not educated enough. So I think that's my big thing, is that I love kids. I love goofing around with kids when they come in the office. I hate seeing a child in pain. I hate seeing a child cry or be afraid of coming to the dentist when there's no reason for that. I hate seeing the first dental visit for a child being an emergency visit. And I hate seeing 50% of the kids we refer to Eastman having to go in the OR when they're under 5 years old to have thousands and thousands of dollars of unneeded dental treatment done if it was just prevented.
And
That's my
I know,
passion.
Dan, you've spent a lot of time in Head Start centers over your career too. What is the impact of having worked in those centers on your passion for this work?
Well, I think my passion really comes from just empathy and just heartfelt need to reduce disparities, among the underserved populations, those who don't have a voice at the table, when decisions are made about what care and provisions are made, or what provisions are made to ensure that people get the health care that they need. And, smiles really tell you a lot. And to see a child or an adult, Tony mentioned families, taking care of families' health, and I work in the Division of Family Health, which, that was a welcomed really name for me to come into, because that's really what it's about. And when I can impact a child and their family, which I have seen happen, it's a remarkable thing. I think in the field of dentistry, we are taught to tackle disease, identify and diagnose the disease, remove it, restore the tooth structure that it has affected so that a person can function. And it's so gratifying. And functioning is something that is bigger than just having the teeth come together so that they can occlude, or that they can talk and eat. But it's bigger than that, so that they can function in the world, because I think people discount or don't really consider how important your oral health is to your quality of life. I have been called upon to talk to in tourism industry about people getting employed because of their oral health, or their lack of being employable because of oral health needs. So, I think my passion really lies in, ensuring that people have health equity and equal opportunity to, have rich quality of lives.
So that kind of takes us into the conversation we had about a month ago. The Schuyler Center was co-sponsor of the Early Childhood Oral Health Summit that was held in Albany last month, along with the Early Childhood Advisory Council, Head Start, the Department of Health, Council on Children and Families, the Office of New Americans from the Governor's Office, and the Developmental Disabilities Planning Council. And it was held in person, and it was thrilling because we had over 130 people actually attend that event. And then we held a follow-up event online in early December to help craft a policy agenda to advance early childhood oral health. And a report is going to be coming early next year on the outcomes of that summit. But you both attended, and Dan, you actually helped plan the event. And I know you're both excited. Tony, you were one of the presenters at the event as well, and so you saw the participants firsthand. What is your one takeaway from that event? What excited you most about all these people coming together to talk about early childhood oral health?
I think I was impressed first with the number of agencies and the enthusiasm of all of the participants. That's number one. And the willingness to collaborate. That's, I think, is my takeaway, is the willingness of the participants to collaborate and move forward to make change. Yeah.
Dr. Richardson, what's your big takeaway from that event?
Yeah, I concur with Dr. Mendocino on that. And I think that As some of the programs or some of the individuals were sharing about some of the initiatives that they already have going on around oral health and Head Starts, I I couldn't help but think that, wow, how do we highlight that in a greater way, in a broader way, so that, you know, either those things can be replicated in other areas, um, or we could somehow leverage support for the resources that, and tap into the resources that were already available in that room, to help us build on some successful initiatives that will hopefully eventually lead to good oral health outcomes for that population and the families within the Head Start programs.
Yeah, I agree. I thought, you know, from our perspective, the fact that we targeted very heavily the early childhood community to attend that event, there was such an overwhelming desire to know more about oral health. I mean, I think we talked a lot to people who are, you know, run childcare centers, Head Start centers. They see this on a daily basis. They see children coming in, you know, as you mentioned, Dr. Tony, that, you know, they have active disease and the families don't know what to do or where to send them. And I think there was a lot of a good conversation about some steps that we can take. And I'm looking forward to seeing what the final policy agenda is going to be. But just the overwhelming desire to know more and to get their hands on resources, to get their hands on materials for parents, having conversations about how we best translate materials. A lot of conversation about the need to translate materials to new Americans, immigrant and refugee families, so that they can also have good oral health, and that we can make some strides in that direction. So I agree with you both. There was a lot of excitement in the room, and we're looking forward to taking that to the next step next year. For those of you attending today's session who are interested, there are materials from that event that are posted on the Schuyler Center's webpage under events. You'll see a tab for the Early Childhood Oral Health Summit, and there's materials from that summit and slide decks and things like that that are posted there, and we'll promote and post the report when it comes out next year. So I'm going to just pivot back a little bit and talk about both of you from the perspective of what does the future hold for the oral health of children, and what impact can we all have on the oral health of children and families? What are your top items here? I want to start with Dr. Richardson.
Sure. Well, the Department of Health will continue to support evidence-based interventions that have proven effective, and we will keep our eyes on emerging interventions and emerging best practices so that we can incorporate those into the work that we do. We will, I believe, continue to provide resources and supports like we do. For example, now we have small grants to support our school-based health centers efforts to increase preventive services, preventive dental sealants and fluoride varnish in their programs. We'll continue to monitor programs to ensure that dental providers are achieving their highest level of quality of care. We will continue to work with our partners, our current partners, as well as we would like to engage with new partners, maybe some non-traditional partners, to help us to learn more and understand how we can even increase efforts to gain access to, or help individuals gain access to needed oral health care services. So I think those are primarily the things that we will be focusing on currently. And I also think that that it's going to take collective work, a collective effort for all of us who are either in the field of oral health, who have interest in oral health and who work with individuals who need oral health to help us move closer to reaching the state goals, national goals that help us really determine and mark, help us to reach our markers for good oral health. So, we'll continue to support things like medical dental integration, I believe, and integrating oral health into other aspects of health. That I think is going to be really critical for us to continue to march forward with making sure that oral health is in view, is in everybody's view, and help people to even further understand the importance of oral health as a part of overall health.
Okay, and Dr. Tony, what is on your horizon? What are you looking
I think my biggest challenge right now is getting that CDHC into the community, educating the population.
Now that's the community dental health coordinator.
Community dental health coordinator.
Okay.
Yes, getting her in the community, have her accessible, educating families, get those children in at the first tooth or first birthday. There still are pediatricians out there. They're telling patients not to bring their kids in until they're 4 or 5 years old. I think working with the state on changing some of the scope of what hygienists can do, what dental assistants can do, maybe increasing the ability for them to offer some more services that they're not allowed to do on their licenses right now. And I think just getting children dental homes, not have children come in for their first visit as a dental emergency. Educate, change that paradigm of drill and fill. Just because my father had dentures at 28, I'm going to have dentures at 28. It's not the case. So I think that getting things out into the community is going to be big. And I'm hoping to maybe get the Head Starts to I'll start at an early Head Start age, because getting into some Head Starts at the kids are 3 and 4 years old, it's way too late. The Head Starts that we're in, that children are in at 6 weeks old, we're seeing almost no decay because we're going into those Head Starts every 3 months and applying varnish and examining those kids.
Tony, I'm gonna have you speak up just a little bit there.
Okay.
So you want to make sure that we get those kids in for fluoride varnish,
Fluoride
and
varnishes,
preventive
get
services
those-
as
get into
quickly
the
as
Head
possible. Yeah.
Starts, get into the Head Starts earlier, get the kids in Head Starts earlier, get that fluoride varnish on those teeth.
Great. Dr. Richardson, I just want to ask you a clarifying question. You had mentioned a couple of times the fluoridation fund. Can you just mention for anybody that's interested what that does and how someone could access or get information on what that fund does to their community?
Sure. So the Department of Health supports community water fluoridation, exploration. So if a system or if a public health water system is interested in exploring whether or not they want to consider fluoridating their water system, we offer funds for that. If a water system is currently fluoridating and they need to purchase new equipment, potentially because their equipment is aging, we provide funds to support that. So that fund is the funding. I'm trying to look for the information for it. I think we will have to maybe share with you, Bridget, when a place or a link for the funding source.
Okay.
We're in the process of just making some administrative changes to the way you apply for it. For instance, for what we have 2 components of it, and the component 1 funding, which allows you to make plans with the appropriate engineering services to help you do that, up to $50,000 for an engineering report will support that for component 1. And then component 2 awards will allow you to repair have efforts or make efforts to maintain fluoridation services within your communities.
Great. So thank you. I just want to clarify a little bit about what that program was. I see that we are out of time, but I'm just gonna mention, we'd all talked about the need for more collaboration in oral health and more different partners, unexpected partners in oral health. So I will invite anyone who wants to become involved in these efforts going forward or get on our mailing list for things like the Early Childhood Oral Health Summit. Is you can email me at bwalsh@scaany.org or our info@scaany.org. And also we have materials on our website as well on children's oral health. So please feel free to take a look at that. And I'm going to thank both of you for joining us today and taking part in our 150th anniversary celebration Schuyler Conversations. And I think with that, we will close today's program. Thank you very much, both of you.
Thanks for having us.
Thank you for having us, Bridget.